everyone, and welcome back to another episode of Making Room for More. This is definitely like an impromptu episode. It's funny because it's kind of surreal that this is happening right now. We just got the call pretty much like a couple days ago to start with all the medications and everything. And so it's got to be probably like 11 o'clock at night almost at this point. And we're like, well, this would be a good one to record. So we're here in our PJs randomly doing an episode, but we wanted to capture the first night of meds. We have the instructions out here, and we're gonna go through this. It's different this time because we have kids, and so all of this stuff is not really starting until after they go to sleep. So they're sound asleep at this point, and we're gonna do this. So, and I will say, I do not like shots. I do not like needles. I do not like blood. I don't like any of that kind of stuff. But this is the necessary part of the process, so we're doing it. Okay, so I have this first thing that we're doing is Lupron. So I have the instructions here, and I want to make sure that I'm doing this right. I looked at it for like a few seconds, and I just want to make sure I got everything. So I'm actually going to get some gauze. I don't remember bleeding or anything before, like excessively, but we're just going to have everything handy because you want to have everything kind of like right there as you need it. So once you do the injection, you're not trying to scramble. So I'm going to get my sterile pads. And I'll just go ahead and open it up a little bit, I guess, in case it's needed. And then the alcohol prep pads. This is the actual medication. So, and one thing too, so washed our hands before we started any of this. So my hands are already clean. I'm going to prepare. I think I'm actually doing this a little bit out of order. I'm supposed to wash my hands at this point, but we're gonna go with it. So it says check the liquid container. It should look clear. And it shouldn't have anything like floating in it. So it looks clear to me. So I think we're good to go on that. I'm actually gonna open this up because I don't want to touch the needle. And now that I see I was supposed to wash my hands kind of after I touched everything that needed to be touched, I'm actually just going to wipe off my fingertips because I know I washed my hands, but just to be on the safe side. And then I just touched another thing. I'm gonna wipe off my fingertips again. Okay, so I'm wiping my fingertips off again after I've already washed my hands. It says to, I'll worry about that later. It says to use if using any vial, flip off the plastic. Clean. Okay, so clean the top of this, I think is what I'm doing. Okay. And remove the outer wrapper of the syringe. Uncover the needle by pulling the cap straight off. Don't touch the needle. Don't touch the needle. I'm sure that's very important. Place the vial on a clean, flat surface. Push the needle through the top. Okay, that's wrong. Because I just broke the needle. I guess this is this supposed to come off? I'm so confused right now. Oh, yeah, I'm not gonna worry about that. Definitely was supposed to take that off. So hopefully there's extra needles in this kit because I just messed up. That's weird, that alcohol swab was dry. Okay, this one was wet. So I'm gonna clean this off. I actually don't really like doing this at all because I'm not a medical professional and I don't know exactly what I'm doing, but I'm just following the instructions at this point. So we'll try this again. New needle. Don't touch the needle. I'm gonna stick this in here. Okay, there we go. And then, okay, what step was I on? Sorry guys, it's been a while. And like I said, I don't know exactly what I'm doing. So, lift the vial and turn it upside down. Check to see that the tip is in the liquid. With the needle tip still in the liquid, slowly pull back until the syringe fills the proper mark. Okay, and I think I'm going for 10 units. So I'm gonna flip this up. I'm gonna turn this around so that I can see the 10. And you don't want bubbles. Okay, so it's on 10. So, all right. So at this point, I think I finally figured it out. And at this point, it's time to inject. So I'm going to actually let Larry do that part because I do not want to stick myself with a needle, particularly this very first time. So I'm just going to be a good patient. I'm going to be really calm and I'm going to let Larry use his professional background to help me out and go ahead and give me this first shot. It's been a little while, I'm not gonna lie. I'm a little bit anxious right now, but I don't think that it's gonna hurt dramatically. I don't remember it being very painful for the first time. So let's do it. I don't, like the liquid squirted out. I don't know if that was supposed to happen. But Larry's coming to do this.
Right.
And you want to hold it there for a second because I need to clean off my stomach. And I talked to the nurse this morning and she said to inject it kind of like in the stomach right before the belly button area, right under the belly button area. So we're going to go with that. So choosing to clean the site with a new alcohol, hold the skin between your thumb and index finger as you were instructed by the doctor. Insert the needle straight into the skin quickly. Push the plunger and inject the medicine. Does that sound familiar?
Sure.
Okay. So we're gonna go right about here. Not on my belly button, obviously. So.
Right here?
Sure, yeah.
She doesn't have very much fat. It's a good thing. All done.
I don't even know where you stuck it.
It's right there.
Should I wipe it off again? I'm clearly like a germaphobe too, so I'm like continuously like wiping things off and everything. So I don't know exactly where he stuck it, but I'm just gonna wipe this whole area. And you have a sharps container, you definitely want to make sure you put your needles in there. And I already busted a needle, so like I said, hopefully there's extra. But that wasn't bad. I think just trying to like get a little bit more organized with it so that next time it doesn't take so long and there's not like stuff everywhere. But overall, first shot of Lupron, day 1, and there's gonna be a lot more to come. So stay tuned, follow us on our social media, put your comments below, and that is it for today's episode of Making Room for More.